All right.
We're not weird here at Apex at all. Here.
You ready?
Yeah.
Okay. Hi, this is Dr. Tiffany Lamonde. This is
Dr. Stephanie Hope.
and we're from Apex Wellness Providers, and this is the first part of at least a 5-part series, maybe more, depending on what happens, about pelvic health.
Mm-hmm.
So today I would like to start with sort of introducing you to the concept of pelvic health, as well as an amazing, very talented pelvic health provider.
Thank you.
So I think we'll just jump right into it. And
Okay.
the first thing is, like, tell me about your education. Like, how did you get to this point of expertise?
So, well, dialing it back a little bit. So I got my psych undergrad degree at UGA.
Okay.
I left there and I thought I was going to take over the world. I moved to Africa.
Really?
Yes.
Okay.
And then came back and decided I was going to still take over the world in nonprofit.
Take over or like save the world?
Save the world.
Save the world, because those are very different things.
No, not take over. I don't have the personality for that. But not like this, no. So save the world, realized I couldn't pay my bills. So went into human resources.
Okay.
It's, yes, strange kind of non sequitur. But so went into human resources, decided that was horrible.
For you.
For me.
Not for everyone.
Not for everyone. We need human resource
Disclosures.
people. Yeah. But for me, just wasn't satisfying. Mm-hmm. So I started taking a couple night classes to get my prereqs under my belt, to finish those out. I had most of them, but then decided to go back to school for physical therapy.
Okay.
To grad school. So
Okay.
I went and got my doctorate from the University of North Georgia.
Okay.
And then graduated from there, and I've been working as a PT. I started pelvic PT really early.
Okay, so you kind of knew early that that's something you wanted to do.
Yes, I knew in school.
So, like, how did that come about?
So I have to credit Dr. Ruth Marr. I'm going to send this to her.
Okay.
So she can look.
So you've had amazing mentors, which, I mean, you're so good at this. It really is amazing to listen to you. I often hear you through the walls or like down the hall or just in your presentations, and you are so knowledgeable and so comfortable. So you've had great mentors, which is kind of how we all become good at what we do, right?
Yeah, I think I also just have an interest in it, and I'm one of those people that doesn't shy away from awkward conversations.
Right, which you couldn't possibly in this situation.
Right, and so I tell people, I talk about poop and pee and sex all day, and it's fun. So,
we all do all of these things. Well, hopefully, in some capacity, do
Sure.
all of these things.
Yeah.
And with reasonable control.
Yes.
Because that's kind of the idea here, right?
Right. So I also had another kind of mentor with that, Dr. Norbosh at UNG, an amazing clinician, thinks way outside the box, and
Which you know that I dig.
yeah, he's so great.
I love a good maverick.
Yes, he's a maveric. I also did some shadowing my senior year, my third year.
My
senior year.
Your final year.
My final year.
Many
of grad school.
years of education.
Yeah.
That's the other thing that people don't realize. I don't think that, first of all, you took a slightly unconventional path. If you take a conventional path, it's still 7 years of school.
Right.
That doesn't include your postdoctoral work, fellowships, residencies, postdoctoral certifications. You have a whole nother degree.
Mm-hmm.
Same as me, I have multiple other
Right.
degrees. And so I don't think people always understand the amount of education and specialty that goes into what we do. And then even within the world of physical therapy, you're a very specialized provider. And we all graduate like a generalist, kind of think of it like a primary care physician.
Right.
And then we go on to do our specialization, and you are like super, super specialized. You do orthopedics exceptionally well, and you do that on a regular basis, but pelvic health is like a tiny niche.
Right.
And to be honest, not a niche that a lot of people do particularly well.
I've learned that more and more as I've been practicing longer and longer.
Yeah, so
Yeah.
for you, it's amazing because you really stand out, because you get a lot of patients that have otherwise maybe not responded the way they could have, and then they come to you, and sometimes it's something really simple.
Right. Yeah.
And you can change their life in a
Yeah.
really meaningful way.
Yeah.
You've also taken everything that you've learned and you've really kind of developed your own way about it, have you not?
Yes. So, every time, so I've taken a lot of continuing education courses.
All the good ones do.
Right. And then you know that each one that you take that you really are motivated by, you kind of take out little nuggets from
Right.
those courses. And then over time, you eventually become kind of this amalgamation of
Yeah.
whatever.
And
Of
it gets
all
to the
of
point where
things.
your expectation is not to like change your world from one course, but that you hope to get 1, 2, maybe 3 pearls that you can integrate into an already thriving practice.
Yes.
Yeah.
I
get that.
I also really enjoy when I go to a course and it really challenges things that I've been doing.
Your preconceived notions.
Yes.
Yeah.
And it seems like the courses come right at the right time. You take them and you're like, oh man, I've just felt like I've been doing this rote thing over and over again. And then you go to this course and you're like, you know, your head explodes and you're like, I'm gonna just change everything.
You know, and it's pretty rare at this point you probably get that kind of epiphany from something, but I do agree that clinically, and maybe you would agree or disagree with this, the longer you practice, the more you realize there's so much more you don't know. I feel like my younger clinical self was far more arrogant and had way less knowledge and experience. After 20 plus years now, I'm going on like 22 years, I think, I'm actually so much more open-minded than I was before, and I would argue much more effective.
That's why the courses I look for now are kind of the outsider. They're
The maverick classes.
The maverick classes.
Yeah.
And they're the ones that are not the mainstream, although I really do appreciate the base of my knowledge was kind of set there by my APTA courses that I've taken all of those. But seeking out the ones that are a little different with the clinicians that think a little bit differently, and I really love those courses now.
I also very much appreciate that. I've come to realize, and I think you would agree with this, that if we focus just solely on traditional medical practices, there's huge gaping holes in what we do, and we miss a lot of really important stuff. So we have to be open to the idea that it doesn't always have to fit in a traditional medical box.
Agreed.
Yeah.
Or traditional PT box.
Yeah, which would fall under mostly a traditional medical model, but not as much anymore depending on who you are.
Yeah, true.
Okay.
So I love pelvic health because I like having a little niche. I do like having a specialty that sets me apart from other therapists. That's nice to have.
Yeah.
I feel like it makes me more marketable. It's better job security in some ways.
Sure.
So there is all of that. It speaks to me personally, just as a woman, but there's men's health too.
Yep. And we're going to cover all of that in this series.
Yes, but being a female that's had kids, there's something that I really connect with pelvic health that I just feel like I can relate deeply to the issues that a lot of my patients are coming to see me for. And I can relate to where they are in their life, in that kind of season of life. And it's really personally and professionally satisfying for me. Not to say it's not satisfying to rehab an ankle or a knee, because it is, but there's something different about pelvic health for me.
Would you venture to say that part of it is society has told women that they need to just put all of that on the down low? They can't talk about it. So many women don't even realize that most women struggle with this, and they definitely don't talk to people, they don't talk to their doctors, they don't seek out treatment. And so once you have created a normalcy around that, you can change people's lives in a really meaningful way.
Totally.
Like, nobody wants to have painful sex, nobody wants to pee their pants, nobody wants to poop their pants.
Right.
But when that does happen to so many people, they hide it.
Yes. So they either hide it and they just carry on with life, right? When they're wearing double pads during exercise, or they stop exercising.
Right. So it affects so many facets of their life.
Right.
Or they can't have intimate relationships with their partners.
Or they don't go get regular pap smears.
Right.
Because it's so painful and they've got such bad PTSD from it. And now they're not getting regular, normal preventive care. So
all the things.
Yes.
Yeah. So shifting gears.
Yes.
Tell me a few things about you that people would not otherwise know. Like starting with maybe this.
I'm a potter.
And she's a brilliant, talented potter. It's like, how can you have so many talents in one person?
She's a potter too.
I suck.
No, you don't.
My
favorite cup that I drink out of here is your cup.
I think you like it because it's quirky.
Yeah, I like quirky stuff.
But yours are like perfect. Like, this is not purchased. She made this.
Well, thank you.
It's freaking beautiful.
I started with pottery because I wanted a hobby that I could work with my hands and produce
Like we don't work
something.
with our hands enough.
Yes, but I wanted to work with my hands in a way that just didn't feel, I wanted it to feel artistic.
I
There
get that.
is an art to PT too, but
100%. But I actually really get that.
Yeah.
I appreciate painting and pottery for the exact same reasons.
and there's something that's therapeutic about dirt.
Yeah, and
Right.
there's something amazing about taking this blob of nothing and turning it into something useful and potentially, especially in your case, beautiful.
And then they make great gifts, so you can just,
Totally.
yes.
I bought all my Christmas gifts from you. So any
She
of my
did.
family and friends that received those gifts, here she is. She is the talented Dr. Hope that made your gifts.
So I'm a potter. I do that multiple times a week.
You have your own wheel.
I have my own wheel. I've got my own little studio that's in my garage.
Yeah.
And I make a lot of things.
Yeah.
So I very much enjoy it.
Is there anything else that would just be interesting to know about you?
I've lived abroad, so lived in Africa. This was pre-PT. And then lived in New Zealand and got back in 2022. It is now 2023.
And that is
I remember
actually
that.
how I met you. So you were, can I share this?
Yes.
She was a patient, and I was curious. I'm like, why are you coming to see me? You work in a thriving practice, and she chose me. I'm flattered. And I found out she was a pelvic health therapist, and I asked her, I was like, have you ever thought about working in a practice like this? And she says, that sounds amazing, but I'm moving to New Zealand.
Yeah.
And I said, well, if you ever move back to the States and this is something that still interests you, I'd love to talk to you.
Yeah.
And then one day you're like, hey, I'm moving back to the US. And I'm like, let's do it.
Yeah. So a lot of people are surprised that I've lived abroad and worked as a physio in another country.
Which is what they call it in New Zealand.
Yep, physiotherapy. It's not physical therapy.
Physio.
So, yeah, that was a great experience and I learned a lot.
And you're a mother and a wife.
I'm a mother, a wife, a dog mom, and to a crazy dog. Oh, and another weird fact. This is the one I always share.
Okay.
This is from when I was much younger. I don't want to say when, but I have won a toilet paper wedding dress contest that was a national contest for toilet paper wedding dresses.
Do you have a picture of this? 'Cause
I
I'd love to insert that here.
I do.
I'm going to insert that so
And-
you guys appreciate the artistic ability of this dress.
Yeah.
I've not seen this.
And we were approached, so my aunt and I did it together while she was going through cancer treatment, so she wanted a distraction. So we did this project, and we were approached by Ripley's Believe It or Not in London to get the
Is the dress there?
No,
Okay.
it's a tragic story. They contacted us like months after we had won,
You
and
ripped it all out?
it was all disassembled, and one piece was over here, and one had been thrown away.
No.
Yeah, so sad. But we had no idea that was going to be
Sure.
asked
I
of
mean,
us. Yeah.
yeah.
And now the contest is huge. It's become crazy huge. But yeah,
I did not know this.
so we won, and then I took my mom and my aunt out on a spa day with our winnings.
Oh, you won money.
Oh, we won money. It was like a national contest. It was like a thing. It's a thing.
See, even I'm learning things.
Okay.
So, how can someone come to see you if they wanted to?
There's multiple ways that they can get in contact with us. Of course, you can just give us a call at Apex Wellness and talk
And
to
we'll list the contact for all that down in the description box.
talk to Maggie, our front desk extraordinaire, and let her know that you're interested in pelvic health. If you've got questions about that, whether or not that's appropriate for you,
Sure.
Maggie has actually
Developed a pretty good working knowledge.
yes, and
Okay.
she has learned a lot. She still runs a lot of things by me if there's something that she has,
As is appropriate.
which is what we want.
Yep.
She asked me about a twisted pelvic floor the other day.
Oh,
I said that's not technically really a diagnosis, but it was good
let's
for her
talk
to
about
ask
it.
me. Yes.
Let's talk about it.
Yes.
Yep.
And so you can give us a call, you can look on our website, you can contact us through the website if you don't feel like actually calling, if that's uncomfortable for you. So you can send a message through our website.
You can
And-
also make an appointment.
And you can make an
Directly
appointment
through the
online. Yep, you can do it online through our website. And then you can also visit any of our social media on our Instagram or Facebook and reach out to us there. Just there's multiple
Lots
ways
of
to
ways.
contact us.
Now, what if someone lives too far away to come in person? Do they have options?
Yes. So telehealth is tricky when it comes to physical therapy, but that's not to say that it can't be done and it can't be done well. So I'm actually used to doing a lot of that. In New Zealand, we had pretty lengthy lockdowns, and 100% of our work was online.
So you did plenty of pelvic health
yes,
through telehealth.
yes,
So-
and initial assessments that I had never met the person before.
Yeah, and like you've told me this in the past, like the gold standard is to do an internal exam, but it is not required,
Right.
and is not always necessary. So
Correct.
now, if for some reason you did do a telehealth and this did not feel like an appropriate fit, you would let the patient know.
Yeah,
Okay.
it's actually really great to do a telehealth. If you're going to pick one for the initial assessment, we're not talking about like the exam, the actual hands-on exam, but the initial assessment has so much history taking, and there's a lot of education, so
Yeah.
that can easily be done
Right.
over Zoom.
And just as a curious side note, like in general, if someone were to spend time with you, and I know this varies wildly based on the diagnosis and severity, but when do generally people start seeing change or results?
Like you said, it does depend.
Of course, we have to have the caveat. But
Right. I've got those unicorns that they've had pain for 20 years and they come see me twice and they're all good.
Yeah,
That has happened.
those are great.
Yes. It's not the general rule, but that does happen. But generally I'll see people anywhere from 6 to 12 to 16 weeks. So depending.
And do they see them every week, or it varies wildly?
It does vary wildly, although the frequency is much less in general than like a typical orthopedic diagnosis.
So they might come every week, every 2 weeks, once a month,
Yep.
so on and so forth.
But I'm generally seeing them for a longer period in
But
duration,
less often.
but less often.
Right.
Yes.
And is that because it just, the things that you're implementing, it takes time for the tissues to adapt and change, or?
There's a lot of things. A lot of it's behavioral change, and that takes time.
Sure. As we are working on in our 30-day challenges,
Right.
behavioral change takes
So
time.
that is one of the toughest things.
Okay.
There's also all these other kind of practitioners that I bring in that they need to be going to regularly.
And that's a
to
big
make
part
that
of what we
happen.
do at Apex is, first of all, if the provider is not here in our environment, we are huge advocates for getting everyone to the people they need in order to meet their health and wellness goals.
Right.
And so that is not always just our providers. We have very strong relationships with lots of other providers in order to get what everyone needs.
Sure. So I've got patients who come to me that I'm like, okay, well, we need to see an endocrinologist. We need to see a sex therapist. We need to see a psychologist. We need to see a nutritionist.
By we, she means them.
them, but
with
we
partner.
as like a collective kind of, this is our partnership that we're forming now.
And that's a piece that is often really lacking in modern healthcare, is that collaboration where the right hand doesn't know what the left hand is doing. And it's so rare. We have a very special opportunity here where we spend such an intense amount of time with patients. We are often responsible for finding lots of things that have been missed and fallen through the cracks, and sometimes very serious things. And so I'm very proud of us and the people that work here at how thorough they are, and how we're primary care providers every single day.
It's also unique with us because we see them, we have a lot of FaceTime with them.
100%. When was the last time you spent 60 minutes one-on-one with anyone for your healthcare?
Right.
It's
Right.
so rare.
Right. It
So
is.
rare.
It is.
And very special.
Yes.
And okay, well, I think that concludes our first series. Yeah?
Yes.
Anything else you'd like to share?
I don't think so.
Okay, well, in the description box below, I will have our contact information, how you can get in touch with us, and if there's any sort of links that are appropriate for this situation or any of the videos moving forward, we'll have those in the description box below.